Hi, everybody. Welcome to another episode of Princess on the Pod. I am your host, Yvette, and today we have a very special guest, Dr. Josh Cacho.
Awesome. Yeah. Like I said, my name is Josh Cacho. Started off at, went to school at La Melinda, got my doctorate there in physical therapy. Subsequently, opened up a orthopedic physical therapy practice in the area. Again, as time went on, things kind of changed. Life happens, and then started to kind of pivot in a couple different directions. And so, again, here we are, right? So again, it's been a long. I mean, I can't. We met in what 2012,
15.
2013, 15.
Well, before that, but like truly became close like 2015.
That
So
makes
more than, 10 years.
time
Time
flies.
flies. Time flies. I like how you just skirted over. I got my doctorate at Loma Linda, opened up my clinic. So for those that haven't listened to 2%, go back and listen to that. On that episode, I talk about a near-death experience where I was also at Loma Linda crossing the street and I almost died. And that is actually how I got introduced to Josh. I was in dire need of a physical therapist to rehab me from being in a coma, bedridden, to being able to go back into surgery. And everybody recommended Josh. And that is how we met because I was his favorite patient.
Of course, of course. I mean, we always say that providers are the worst patients, right? But that definitely wasn't your case.
Thank you, Matt. So let's talk a little bit about owning your own clinic and opening up a business and the struggles of that. I don't think I could have really understood what you were going through until I went through the steps and process myself. And you really don't truly understand, in my opinion, until you have your own clinic, your own office. You can just be an outsider, but once you're stepping through it, it's different, right?
Yeah, absolutely. That owning a clinic or opening up my own business and actually is probably more the goal, right? My dad is a general dentist. He owned his own practice and he worked for what almost just over 30 years. He retired in 2020, end of 2021. And so growing up, that was always what I looked up to and kind of what I wanted to do, right? And again, I think it's similar situation to yourself, right? Where you just see, like I said, what not for the freedom, but I mean, truly the freedom to be able to make decisions on your own terms. And I remember asking him those questions as we were growing up too, right? Like, like why did you decide to open? It's like, well, I don't want to, like that working for someone else just wasn't in the cards for him, right? He just felt like he wanted to be able to be his own boss and those types of things. And again, I always idolized that journey. And so it was only natural that I found an opportunity that kind of led me in that direction. And so again, also being a bit risk averse, right? I did end up going through a larger corporation, right? And so I owned I think it's about 40% of the company
Yeah.
or of the clinic. They own the other 60%. And so obviously, like I said, it wasn't now in hindsight, because hindsight's always 2020, but then now going into other business ventures where you're now 100% the owner, again, it also changes that dynamic as well, right? So you make decisions in a much different way when the financial responsibility is solely yours.
Right. So different, I think it's a trade-off, right? Or a different outline versus when you own your own clinic or business or whatever, you're just kind of a cowboy at the end of the day and it all falls on you, like you said.
Yeah, like, and again, and both benefits and downside, right? Like, again, there's the upside of like you're saying, of being in a corporate setting where you have that backing, you have that support. You're not taking capital risk investments. You're not having to take out a $200,000, $300,000, $400,000 business loan just to get through your first couple months and buy equipment. And I mean, dentistry is even different. Like for
Right.
PT, as long as I have a table and a towel, it's a whole different. I'm good. But in your guys' case, there's so much more of an expenditure. So obviously it can be attractive to just say, hey, I can, again, you're generally salaried, right? So that clinic is generally your responsibility. So it comes
Right.
with some of the stresses, but not all of them. Right. And again, it's to each their own, right? Everyone's risk tolerance is going to be a little bit different. But then, as time goes on, you're just like, man, like, am I taking full advantage of the skills that I learned? And maybe at the
Right.
time I wasn't ready for it, again, and being fresh out of school with my current my financial situation at the time with PT reimbursement not being the greatest in the
Right.
world, So all these things come into play in terms of like, okay, what decision are you ultimately going to make, right? And do you go for a corporate setting where you have some ownership but not all? Do you go sole owner? Do you go work for the hospital where you have even the most amount of security, right? Like those options are all there. But I think the biggest thing is, again, it's something that is like I've had to remind myself not to look back and like, oh, I wish I would have done this. It's more, what lessons did I learn along the way that can now guide my decisions moving forward. So like in this moment, I wasn't at that moment, maybe I wasn't ready to go 100% in, but fast forward, right, 15 years later, and it's a much different conversation.
Yeah. Were you guys taught in physical therapy school at all how to run your own clinics, run your own business, or was it just solely focused on the sciences and learning your craft and learning about the human body and movement, much like dentistry, as we maybe had three business classes, a few?
Yeah, I mean, we had I think it's closer to that. We had one business class and it felt like the majority of the time they were discouraging. It was other practitioners discouraging us from going into the profession, at least at that in that way. Whether they were trying to limit competition or it was the reality of the situation, which is but again, I think there's multiple things that can be true at the same time.
Right.
That again, they weren't lying about the difficulty of opening up your own solo practice, and they also weren't lying about reimbursement is not great because of what our professional organizations are doing and some of those things too. Yeah, like I wish there were more because I know like chiropractors, for example, right?
Right.
Like half the school is marketing, right?
Hmm.
Comparatively to on our side where, like I said, it's because it became a doctorate level profession, they added research requirements, added these different things, and to be able to fit that in within the amount of schooling plus your clinicals, I think made it hard to try and fit everything in. I know they've tried to kind of find opportunities. I know at one point they had asked us, we came in and spoke with the school at one time. We've done some lectures here and there about that same thing, about private practice ownership.
Mhm. Right. I like that. You were an attending, right?
We don't have like the same hierarchy that we do in the hospital, but you are clinical instructors, right? If anything, right? So you'll get students that come through, rotate through your clinic, and they have to do usually the longer rotations are like 11 weeks at a time. So that was always my hiring pool. Bring them in, have them do the internship, and then kind of make a decision. Like if they're this good when they're working for free, my assumption is that when I'm actually paying them, they're probably going to be just as good, if not better.
Yeah.
And generally speaking, that was the case, right? And I just did the same thing for my support staff. So a lot of them came through as high school students or as college students doing internships. Would hire them as techs in the clinic or in the front office space, and then give them jobs until they were ready to start grad school. I was okay with the turnover because it was actually a good marketing point. I could say, hey, if you come here and work, I'm going to help you push you to bigger
Right.
and better things. And like, versus a lot of times people want to, like, because it's a disruption to my business flow, it becomes, I'm going to hold you back. Right. And I wanted to get away from that to a degree.
Yeah, I remember going to your clinic and there was always like students there, whether they were working up front or doing their rotation through your clinic, but you always had students there. I had the same business model and I hope people really listen to what you said because you can use it to your advantage to have these pre-med, pre-dental students who really want to learn. They have the flexibility in college. You just have to be willing to teach, explain, and patients are generally really open to it. And I liked it as your patient. My patients like it because they see like, hey, she cares, she's mentoring. So you can use it to your advantage. And then like you and I see it as with our business mindset, you're like, these students are going to remember me because they had a good experience and therefore it will bring referrals back. So you're just kind of helping grow the profession and the understanding of what we do, you know?
Yeah, especially in the specialist space, right? Like obviously within PT, if I have PT students, they may open a competing business, right? So that's
Mhm.
always a thing. But at the same time, like if you do a good job, I really don't, like the work speaks for itself. The business will
Right.
come, especially in our space, and trust and relationships matter more than just about
Yes.
anything, especially today. Right. And so being able to have someone that you can trust as a patient, right? Like I said, I would never go to anyone else other than, like than you if I needed perio care. But, and especially the more that I learn and I'm like, oh crap, so I was already like, like my family and I are back in the US for about 6 weeks temporarily, then coming back again afterwards. But I was like, "Ah, I need you to take a look at this, or I just need some advice," because again, it's about trust, right? And people understand that what that means from a like they can tell if you're being genuine. They can tell if you're just trying to sell them something. Obviously, in our on our from our perspective, it's just one of those situations where I think being in the Loma Linda bubble to a forced to like you can't burn bridges because there's just too many people that are involved one way or another. And again, and so the way that I've always looked at it, because even now, again, I never thought of it at the time. It was like I just did these things because I thought it was fun. I enjoyed having the students in there,
Right.
being in the mix. But then again, 15 years later, I now have those same students that maybe not even from and PT internships. They were like high school football students that I coached or whatever that are now physicians and are like, oh yeah, you need referrals, I got you, and they'll take care of
Yeah.
it. Again, or we even had one who was one of the parents of the kids and helped us out with our business formation stuff. Like he's a corporate lawyer and he's like, hey, yeah, I'll help you guys out, no problem. Again, no one blinked an eye because relationships matter, right? And I think ultimately that's where, again, it's why we're having this conversation today. But ultimately, I think it's why I've been able to make them, like myself and my family, I've been able to make the moves that we have because we've navigated that space fairly, in a way that, again, like I've never looked at at people, others as competition, right? I try not to get away from this kind of crab mentality, and it's more like,
The scarcity mindset, you don't have
yeah,
that, like yeah,
versus an abundance mindset, right? And I
yes.
think we see that in the world today, rather, like not even just like within our small spaces in business, but I think just in the world, right? Acting from a place of abundance is much different than acting from a place of scarcity. And so trying to kind of shift gears, because I definitely, as a business owner, for the first couple of years, I was definitely like that. And I never grew the way that I wanted to
Mhm.
versus, again, acting from a place of abundance, whether I actually had it or not, but realizing that abundance doesn't necessarily mean dollars and cents. It means community. It means, like not just financial, but it also means and what's around you, right? Who
Mhm.
are the people that can support you? What is the network you've built up? Because again, when you treat people right, they, again, it generally will return in kind.
Yeah, exactly. Do you think it's because we went to a Christian faith-based school, so it was kind of like woven into us, if you will? Because I talked to other friends and colleagues, and they had a horrible experience in their doctorate programs where people would kind of sabotage each other. And of course, you see it, but I think we choose to look at it from a different lens and choose to take a step back and not have that scarcity mindset and think in terms of abundance, as you said. So do
Yeah,
you think it
for
had something
sure.
to do with
Right.
that?
I think there's multiple things, right? Obviously, like it's ingrained in the mantra of the school, right? Loma
Yeah.
Linda, it's to make man whole. We have this community that, again, function like if you look at what Loma Linda is and the location that is, there's no reason why it should be what it
Right.
is. Right. It's one in the lowest socioeconomic areas in the country, right? One of the poorest counties in the country, yet they make it work. They find ways because again, their goal is to work together as a community to put good into the world. And obviously, individuals don't always act in that way, right? Obviously, there's always going to be people within there that are going to do their thing. But I think as a whole, right, that mindset is instilled in us to a degree. And then beyond that, just even if you want to remove that portion out of it, just the fact that we're, like a lot of times, I don't know if many schools are like this, but because we're all just kind of lumped into the same rooms all
Yes.
together, those interdisciplinary relationships, like at Loma Linda, we just happen to be around where there's nurses there, there's dentists
Mhm.
there, there's hygienists everywhere. There's medical students. Like the dentists date the medical students, and vice versa,
Yes.
and the PTs. Like again, it's this weird conglomeration of professionals in one setting that, again, I think has a lot of upside, and you learn a lot of life lessons that you probably wouldn't if you were isolated again. And that's not even including the faith-based component, which definitely
Right.
amplifies that even to a bigger degree,
Definitely.
which and
It is
then
so wild.
yeah, because I remember
It's
growing up there, like when my mom was working as a NICU nurse in the hospital, and it's just, just the one tower. Now it's just this
yeah.
huge thing in the middle of town, right? And then that's not even including the upgrades to the university, which, have
Mhm.
obviously like have happened too, and then, which is wonderful because, again, for the faults of every institution, I do think Loma Linda, on the average, like I said, is going to put out, like I said, you're putting out good students with the right mindset, right? And then again,
Right.
I can't say that for every single institution that's out there.
I I agree for sure. I think going there, it makes you very hireable. People know that and they know what the pillars of the school are and they want to hire you, you know? Plus it's a great school, but obviously we're biased. Remind me what class your dad was for dental school?
He
What year?
graduated in 1991.
Well, okay. I was like, I feel like our dads were classmates, but no, my dad graduated 10 years before your dad.
Yeah, my
And
dad, he had a little bit of a longer path. He ended up going he did med tech first while
mhm,
they were getting their feet they're, getting established here. My dad moved from the Philippines when in the 70s, and
uh-huh,
then was in Hawaii, and then to La Sierra, then to Loma Linda, but didn't really know what he wanted to do at first. He was gonna go do medicine in the Philippines and wasn't his vibe, so ended up coming back, did med tech, and then or now CLS, right, I think is what it's the proper term, and
yeah.
then into dentistry afterwards.
Okay, so you did physical therapy, and then what sparked your move? Tell everybody where you live now, which I think is
Yes.
super interesting.
Um, so my family and I moved to the Philippines about 2.5 years ago now, and that change was pretty much all post-COVID, right? It changed again. I think I had this mindset where I was just gonna grind it out every single day. I'd go get to the clinic at 7:30, leave at 6:30 at night. Like I would pick my daughter up in the middle of the day, bring her to the clinic, and then, she'd be with me until we went home. And then my wife, who's a nurse practitioner, we wouldn't see her until we got home. And so like
Yeah,
it started to wear on us. And I think after COVID, it was one of these situations where you just kind of realize that nothing was quite the same after that, right? Like you realize within corporations how expendable you were. And again, no fault to I mean, people had to make decisions at the corporate level to figure out how
right.
to make businesses survive. Again, now as a business owner, I don't what's it called? Like I understand the
Like fault
decisions.
them. Yeah, yeah. You
Yeah,
don't
you
take it
make the
personal.
decisions you make with the information you have, and again, everyone had to make decisions quickly because no one knew the heck what
Right.
was going on. But at the
Nope.
same time, I just started to think a little bit differently and kind of reprioritize things. And then again, at the time, like I said, now and also being a dad, being a husband, you start to kind of realize like how do I like my priorities may not be in the right place. I think that I'm being a good husband and good father because I'm working hard and I'm providing, but I'm never with them for said
Right.
provision, right? And that time mattered ultimately. And so when I actually had an opportunity, I ended up moving into the wound care space, which um my wife and I ended up working for. She kind of brought me over to the wound care company she was working with,
Uh-huh.
and yeah, we did that. Ended up on the administrative side. Ended up being remote,
Mhm.
so kind of we're working wherever we needed to work from. I was more on the operations side, just kind of having run
Mhm.
a clinic, having dealt with DME companies, all these different things like that just naturally gravitated into that space. And yeah, so we did that up until again 2 weeks ago, right? And
And
yeah,
then what happened 2 weeks ago?
so about 2 weeks ago, the company announced, or actually about a month ago, but 2 weeks ago officially, the company announced that they were closing down because of some issues that they were having financially. We won't
Yeah,
dive too much into that because I mean, we there's a
right.
lot there's a lot that went on, and so things changed. And again, that security and that remote job and everything that we were dealing with, yeah, was no longer a thing. So obviously now it's kind of pivoted and changed our mindset. But the crazy thing is, I think because of what happened during COVID, I had always been skeptical, right? I was
Mhm.
like always cognizant of the fact that like you never know, like no matter how good a company, whatever, how good the trajectory of a company may seem, no matter how good things may be, you just don't want to put your eggs into one basket, right? And
Right.
you always hear it, and it feels like it's cliche saying like, "Oh, you want to diversify your portfolio." Right. Again, we think about it just in the context of stocks, but when we
Mhm.
think about it in the context of like our actual income,
Right.
something that we have to think about, right? And again, imagine, like I said, this was myself, my wife, and then, like I said, two of our business partners now. It's a husband and wife as well. But all four of us lost our job at the same time, right? So
Right.
it it obviously put things into perspective, but also, like I said, we were fortunate that we had started doing stuff when we had made that move to start building businesses out there, but also build some businesses there locally, but also internationally, where yeah, we could do business with clients here in the US. And then
Mhm.
now it's actually opened up more avenues for what we're doing now.
Yeah. What are you Can you talk about what your next step is? Are you just gonna take a break, relax a little bit? You're back
I mean,
stateside?
if let's put it this way, if only one of us had lost our jobs, right? Then maybe we have that luxury. But all things considered, like I said, there's no rest for the weary.
Right.
So one of the things that we started doing, actually, this has been over the last year and a half or so, is like we provide managed virtual assistant services.
Uh-huh.
So that's one of the things that we do. And again, the reason why is like I said, there's virtual assistant places you can go, you can find someone, you can go on Upwork, and those different things, and it can be hit or miss, right? You can find someone that's really great, and I think you've had that experience where you have amazing people that work for you. Some people have not had that same experience, and they wanted something that was a little bit more managed. And in our case, again, because we have a footprint in the Philippines, because
Mhm.
we have a pool of candidates that we draw from, and then we also have on-site management that actually makes sure that like they check in, we do all, and they make sure people are actually doing their jobs. We have guaranteed replacement. So if, like I said, for example, if, something happened and the VA didn't work out the way you wanted to, we replaced them, we replace them no cost. We just find the next person for you and we roll right along. And sometimes like even from a financial perspective, how you do that on your taxes, we try to make it as easy as possible. You just pay the management service, and
Yeah.
that's it. Everything else is done. We do all that, all that, their tracking, all their stuff back in the Philippines. So try to make that as easy as possible for people. But beyond that, we actually launched our own wound care company. Actually, we just had our meeting. We had our kind of a leadership meeting before this call. So now, like I said, I sit as the chief operating officer of Vertex Wound Specialists, which is a mobile wound care company, and we go into people, for home health, hospice,
Yeah.
into facilities, go and provide wound care in the space itself. Advanced wound care. So again, these are ones that are chronic. There are chronic wounds that aren't healing. We'll go in there, provide our services, make sure we can figure out how to get that thing closed. Again, we just don't want people to have to suffer any more than they already are from whatever sicknesses they may be dealing with. So serve the patients, but as well as a care partner with the administrators and with the people, the owners of these agencies that will get dinged, and they face fines and stuff if those things aren't addressed. Like having a care partner in that space too is beneficial. So that's kind of the lane that we're in now. Like it's been a whirlwind of I was came in November, was initially for a tech retreat because I was a product
Okay.
manager for our EMR. And
Uh-huh.
then like a week, like I booked my flight, and then like a week before I was supposed to leave, they announced the closure, and I was like,
Oh,
"Oh, what I'm gonna do now?" When I came back, just the conversations that I had, like, coming back to that thing we were talking about with community, the people that I had worked with for years, that kids I'd coached,
right.
everyone was so willing to just step up and be like, "Hey, how can we help? I know this person. I can introduce you to the owner of this
Right.
home health agency," or I'm like, "Oh, my cousin is an administrator at this skilled nursing facility. We'll put you in touch," right? So again, like I was just taken aback by how amazing again, what community can really do.
Uh-huh.
And then to that point, right? Like now as we enter into this new venture, it's been a focal point of how we wanted to approach it, right? Whereas, like I said, we just want to make sure we put our community first, whether that's our
Mhm.
community of patients or our community of clinicians, finding ways to lift up the people around us as we navigate, right? And navigate life and
Right.
navigate work, healthcare, all these different things. Again, the regulatory environment is not always friendly to us. So, you
Uh,
working together to be able to figure those things out is so much more easy than having a crab mentality. And it's like, if I'm not going to succeed, no one will succeed. I just wanted to make sure we veered away from that.
The crabs in a bucket. So there's kind of two sides to what happened, right? Like you can look at it either way. Like we both lost our jobs, the company announced their closure, or you can look at it like we're going to lean into each other and figure out what to do next together, along with
Absolutely.
your colleagues that also
Yeah,
lost their
and like we
jobs.
were talking about earlier, right? Like, if we were to talk, when I first graduated from school and I first went into that first venture in corporate physical
Hang on,
therapy,
my male guy's here.
right?
Hang on.
Yeah.
I'm on a podcast. You want to hop on the pod? I'm dead. Are you sure? Will your company get mad at you? No. The government? No. You want to hop on the pod? No, Mel's here. Thanks, though. Bye. Merry Christmas. Merry Bye. Christmas. Bye. Bye. I
Right.
just want to do. I know. had, like, FedEx pop in too. I wanna do, like, do you remember Blue's Clues when he's like, "Mail here," and just be, like,
Again,
part of my own show.
but I'm just saying, like, the fact that, like I said, those relationships matter, right? Because ultimately, you never know where they'll take you.
Probably breaking HIPAA, but became my patient because I see him every day, and I was like, "Who's your dentist?" Guess what? It's me.
Yeah. So, yeah, I mean, again, so kind of just to get back, like if we were talking, this was 15 years ago, I was not at all ready to go into this on our own. Right now, fast forward, the lessons I learned, whether it was as a clinic director, clinic owner, or then in as an operations manager, and then now going into our own space, right? Like, I feel fully confident in the team that we have to be able to, yeah, we can do this because
Yeah.
we've garnered all this experience. So, like I said, you can look at it from that perspective, like, woe was me. I look at everything that I've lost, or I can look at what did I gain along the way that helps set me up for the next thing. Right.
Right. What gave you that mindset? Was it a book or a podcast, or was it everything combined, like your upbringing, your parents, your experiences, or was it just always kind of this like voice that you had within you of how to look at the situation like that?
Church is, I mean, again, church has been a big influence, right? Like I said, like I said, we try to make faith a kind of a center of our family dynamic. So, like I said, I think there's always that mindset where it's like, it doesn't do good. I mean, what good is it going to do for me to just sit here and commiserate, right? Like you said, like take your time to grieve, right? We definitely had those moments. My wife and I sitting, crying over it,
Yeah.
praying over it, trying to really, fighting over it. It's not an easy thing to have gone through. Yet at the same time, when you take a step back, and I think also being in the Philippines gave us a different perspective, right?
Yeah.
Because you understand how much you truly have. And especially when you're in the States, it puts things into perspective. This is kind of like the mission trip phenomenon. So, like,
Right.
obviously, like, we've, like, having gone to Loma Linda and in the system, there's always these opportunities to go and do mission trips. And it's always that phenomenon that kind of puts things into perspective. And I think that's why sometimes Loma Linda students have a different mindset, is because you realize how much you have in comparison, right?
Right.
Like, for as bad as things may be, right? There's always someone that is in greater need than I am. And when I look at that, and it's like, well, and again, and that's the thing. So we got to this point, right? We lost our jobs. And like, well, we're both professionals. My
Hmm.
wife is a nurse practitioner. She has her
Right.
master's in leadership as well. So if she wants to find a job, she can do it.
Right.
If for myself, I have a managerial experience in multiple spaces. If I need to find a job in the immediacy, we can do that, right? Is it exactly what you want? Is it remote? Is it high paying? All these different things? Probably not. But could I find a job that's going to pay me very well, both of us, and grind it out? Yeah. Is that where we felt like we were being led to, and where the moment was taking us? No, right? It just felt like everything was cascading to this moment where, between myself, my wife, and our three business partners, we felt like it was an overwhelming sign where we're like, yeah, this is where we got to give it a shot. And if it
Right.
works out, wonderful. If it doesn't, but we can truly focus on growing our company and these different things in a way that makes sense, right? And we'll get to that point, and then, like I said, like, we're actually just waiting for medical credentialing. That's always, like, the worst thing, because
Yes.
once we have our credentialing, then we're on the normal Medicare AR, cycle, where it's like 14 to 21 days after we submit our claims.
Yeah.
We're in, again, when you're dealing with insurance, you're always just waiting for that.
Waiting,
It's
the
just a wait.
waiting period. Yeah.
Yeah,
We lost your claim. Oh no, this never is. And you're like, what? What is
exactly.
happening?
Again, it's not something that we're ever taught in professional school. Like, I know how to treat patients really well. I've learned how to be a business person along the way, with a lot of hard lessons learned that, I wish I would have just someone would have taught me beforehand. I didn't have them to make that mistake. But at the same time, because I made them, it's not something that we ever repeat. Right.
Yeah. No, you need to go through it. I really, really think like hindsight, think about I would think the same thoughts of the speakers that would come in during lunch and their private practice owners, or when I was a free dental student and they would get different dentists to come in and they would be like, don't do it. And now I kind of have that mindset where I'm like, don't do it, but do it if you want.
Well, until you walk the mile in someone else's shoes, right? Like, you don't really know
Yeah.
until you've done it yourself.
Yeah, yeah, but it's really tough, and again, it's something that we're not taught. And you didn't go to business school, right? This is all learning. Yep.
I because I was, like you said, an interesting student. I decided that I was going to do pre PT Actually, I was pre-med physical education to start off with, then switched over
Okay.
to pre-PT physical education because I just enjoyed coaching sports. So that was like, "Ah, if it doesn't work out, I'll just go coach football for
Coach.
the rest of my life and figure out
There's
whatever
always
I'm gonna do after
something.
the fact." Yeah. So again, the business stuff is all just secondhand that I've learned from my dad. Like I
Uh-huh.
said, my brother-in-law is an orthodontist. Like so
Uh-huh.
even now, like even though he started his business, he's only been in business now for 3 years, but
Yeah.
now it's like just like learning from him. Again,
Right.
whether he technically has less experience, but I'm going to learn just the same. Right. And I think also the mindset is like whatever opportunities they have to soak up information and to learn, like I said, like I'm gonna take it. Right. And like I'm probably gonna be bugging you about the same things. Like, hey, how do you deal with this? Whatever.
Business is business. Like, we all have different permits, different things that we have to maneuver through, but a lot of businesses are at the core the same. The girl across the way, she has a spa, and we always leave around the same time, and when I first moved into the building, she was like, "It's fun, right? Thinking about being a business owner till you're actually there." Was like, "Oh, she said you guys talk in the parking lot?" And I'm like, "Yeah, because you're walking to your car together at the end of the day and just kind of, venting a little bit about how tough it is to be a business owner." Completely different businesses, but at the end of the day, they're the same because we're dealing with people, patients, patient care, even with the virtual assistants. I think that's my one thing I wish I would have done from the beginning where I learned the hard way. I wish somebody would have told me when I did the startup, you need a virtual assistant from the beginning. I think that would have saved me a lot of the struggles. But again, I wouldn't appreciate what I have now. And I wouldn't be able to delegate everything that I delegate out to my VA if I didn't go through it myself, right?
Exactly. I mean, and again, obviously, sometimes the cost feels prohibitive. The way that we operate, we find people that are in your field. We'll find, we have dentists that, in the Philippines that will work as VAs for
Yeah.
dentists here in the States and they
Yes.
understand the lingo. So if you
Yeah.
have those conversations and you need to be able to say, hey, like I need X, Y, or Z, can you make sure that this claim, they're scrubbing yeah, for example, if you have someone that's scrubbing your claims,
Yeah.
right, before you send it out. A lot of times as business owners, and for you as a surgeon, you don't have that time to be able, like you barely have enough time as it is, let alone be able to teach someone these things. And so to be able to have someone that knows what you're talking about already, and then will just pick up the nuances of your particular business or specialty,
Hmm.
I mean, that's a godsend that I think has, like that has helped businesses scale in a way that I don't think was possible before.
No. And I think it was almost frowned upon too. Even a lot of my colleagues that I've turned on to getting a VA, they think about like if you were to call Wells Fargo or Chase Bank or Nordstrom, wherever, filing a credit card complaint is the first thing I can think of. You call that 1-800 number and then you're routed over to somewhere international, probably. Now, hindsight, thinking about it as a business owner, you understand why people are outsourcing a lot of these tasks. And same for my administration, my team, your team. You don't want those tasks tied up between us, right? Because we're all busy. We have other things that we need to focus on. Like for me, patient care right now, right?
Yeah, I mean, like patient care already takes up enough time as it is, but
Mhm.
how do you even work on business strategy? How do you work on business growth and like those specific things if you're now having to go back and do back office things that, again,
Right.
not, that you can have someone, again, that is not even just, that is a professional nonetheless, right? Being able to go through and help you do that. Like I said, everyone's experience is a little bit different. From our perspective, we can help. Like if it's a struggle and you're not sure where to start, reach out, let us know, and we can help you find someone that hopefully we have a pretty thorough screening and interview process. So it's like it's not something that you just like, here's the person and you just jump in right away. We want to make
Yeah.
sure that they vibe with you. We have a startup pharmacist and a PT clinic, one of my buddies that they're bringing on some VAs again just to kind of as they launch new locations. And I think that's been the kind of
Yeah.
neat thing, like they did the first one. He did his first one the traditional way, and then realized in the second one he's gonna probably go, like I said, because of the lessons learned and some of these different things, and not even just like the back office things. He's brought on social media staff as well, like on a
Yeah.
project basis. Some of these things that like again in marketing, setting up your Mailchimp funnel, setting up your
Uh-huh.
what CRM. I mean, not specifically Mailchimp, but your CRM funnels like, these are all things that, again, they're doing it for company, for corporations in the Philippines, and they're happy to do it for private practices and private businesses here because again, it the opportunity for them is great.
Right. Right. And it makes sense, right? And then that way your business is growing while you're sleeping, which I think is the goal for everybody. And then you get that peace of mind knowing I delegated this task, it's going to get done. And I can wake up with peace of mind, which I think the stress and it leads to a lot of the burnout and VAs help with
Yes. I mean,
that burnout.
I think sometimes like that if you don't already have an established workflow, that's where it can get kind of icky because there's like you don't even know where to start. We do help with that too, where it's like we can figure out, it kind of a consulting piece where it's like you come in, help figure out what
Mhm.
that workflow looks like. How can we both
Mhm.
most maximize the talent that you're bringing on? Because now, like I said, for my PT friend. They're looking, it's starting out as like triage when people call into the clinic so
Right.
he can direct them to services. And as a PT in the Philippines, they're basically like they know that they're going to guide them towards cryo if this is what they're dealing with, or they're going to
Mhm.
the sauna, so they can help upsell your services accordingly because they know what it's for, right?
Right.
And from a clinical perspective, they understand what that looks for. And then beyond that, like I said, he's having them do some claim scrubbing because they're
Mhm.
talented enough to be able to do that as well in their free time. And then, yeah, so then it's like start with that. And then as he scales, then he'll bring on a few more to separate those tasks individually. Because the assumption, right, is like when you go from seeing 10 patients a week to 100 patients a week,
Right.
like normally you're going to have that staff, the back office staff to help support those processes. But now you're
Mhm.
doing it at half the cost
Right.
because
Exactly.
the average, like I said, generally speaking, the average cost is somewhere between $8 and $12 an hour.
Right. And I think you just grow more that way. So you're going to pay somebody $8 versus, let's say, $30 an hour when that $30 an hour back office assistant or what have you, now they have the freedom and flexibility to look at inventory, look at patients, and to look at everything. And that just helps you grow and grow the business.
It's my mom running through the background. Um, yeah, no, absolutely, right, and again, it's those things that normally are gonna eat up your working capital that now you can spend in other ways, right? Again, what you're not spending on back office, you can now push all that into marketing. Or if you have multiple clinicians or you have multiple
Hang on.
providers, you can help
Hang on.
support
Someone's
them.
trying to pause. Okay. They were all looking inside. I'm like, this has been an eventful podcast.
Hey, hard to turn down
Okay.
payment though, so you gotta make it you gotta do what you gotta do. Our AR is hard enough as it is.
I know. Just took cash. Okay, friends. So let's plug your businesses. Let's start with the VA business. Where can everybody find you guys?
Yeah, so go ahead and head over to sakarimanagement.com, but
Okay.
sakarimanagement.com there
And I'll
for that.
hyperlink that down in the description box. And then your other business. Have you
Yeah,
started the website or working on
we
it?
do. I mean, like we're this it's been
Wow.
an eventful
10 toes in.
month or so, right? So that one is Vertex Wound Specialists, right? Again, mobile wound care, vertexws.com. Again, if you're in the home health space, hospice space, facility space, you need, like I said, we get in there, take care of all of your wound care needs. We're here for you.
Awesome. Okay. Thank you so much for hopping on the podcast. I hope anybody that's interested in physical therapy, being a business owner, moving to the Philippines took away some pearls. And thank you so much for hopping on the pod. I look forward to having you on again. And let's do a follow up update once everything's launched and going. Because I feel like in 2 years, you guys are going to be somewhere else doing something different, opening a third business or something.
You never know.
Yeah.
You move where you called.
Right. Okay. Bye, everyone.